Hi, everyone. Welcome to CCA and Moebius Syndrome Foundation's joint webinar on healthcare transition. Lately, we've been getting a lot of questions. It's been a big question on our survey feedback that you all want to know more about the personal experience of healthcare transition. So we're so excited to bring together this panel today and share some personal experiences about that role of transitioning from pediatric care into adult health care and how you as parents and caregivers can support that and how you as young people can prepare yourselves and handle that. So I'm excited today that we have this wonderful panel assembled. And again, I want to thank the Moebius Syndrome Foundation for helping us collaborate and bring together these individuals. And these individuals are, we have with us, many of you know, Jackman. She's with CCA. And then we have our two Moebius Syndrome Foundation volunteers who are Megan Menard and Michael Mendenhall. Thank you all. So I myself am Erica Klauber. I'm the Executive Director of Children's Craniofacial Association. And we are pleased that this is one of our virtual programs. We aim to do one virtual program a month. And this month it is the Healthcare Transition Webinar. I do want to remind everyone that these sessions are for informational and educational purposes. We will not be able to nor do we intend to diagnose or treat any illness or condition. No one on this call can offer specific or individualized medical advice, but we can share from our own experiences. For medical advice or professional help, we suggest you contact your personal medical doctor, your craniofacial team, or a nurse practitioner that works in one of the clinics you visit. Please understand that the views, thoughts, and opinions expressed in this program belong solely to the speakers and not necessarily to Children's Craniofacial Association, the Moebius Syndrome Foundation, the speaker's schools, employers, organizations, committees, or other groups that they may be involved with. So once again, thank you all for joining us. And I'm going to start with a little round robin introduction. Michael, will you introduce yourself first?
Sure. My name is Michael Mendenhall. I'm from Las Vegas, Nevada. I just turned 40 years old this year, and I'm an attorney practicing here mainly in estate and probate issues. So.
Awesome. That's fantastic. Thank you so much. Megan, how about you?
Hello, everyone. My name is Megan Menard. I am 24 years old and I live out here in New Hampshire in the United States. So on the other side of the country to Michael, which is awesome. Similar to Michael, I am also in legal and financing works, helping with back office documentation for IRAs and trust funds for people looking to retire. So yeah, just happy to be here.
Oh, fantastic. I might have some questions for you, Megan, later after this webinar.
Yeah, then we'll figure it out.
And Kara, how about you?
Hi, my name is Jackman. I'm Adult Programs Coordinator with Children's Craniofacial Association and also Communications Manager with the Learning Health Systems Rehabilitation Research Network. I live in Massachusetts, and I was born with cleft lip and palate, and I'm really excited to share some more about my experiences transitioning from pediatric to adult care. Thank you.
Fantastic. Excellent. Well, before we dive right into the questions that we have for today, I do want to refer anyone watching. We are basing a lot of this, these questions in this work off of gottransition.org. We will put that in the comments of this video, but it's gottransition.org, and that's a federally funded resource that has all sorts of documents and templates and downloads and role playing that you can do and you can access online there to help prepare your child for transition or to help if you are in the sphere of public health. So there's resources for caregivers, patients, and providers as well on that. All right, with that, I'm going to ask the first question. We'll just do this one round robin, and why don't we go in backwards order and start with Kara. What kind of doctors or surgeons did you see growing up?
So growing up for care of the bilateral cleft lip and palate, I saw I saw a plastic surgeon. I saw an ENT that would closely check my ear, nose, and throat. I saw dental people, orthodontics from the very beginning, speech and language pathologists, audiologists to monitor hearing again, and then once in a while, I would kind of dip in and out of therapy. So I would go see a psychologist from time to time as needed. Due to time constraints, we weren't too great about maintaining that. But that's pretty much what I also had. I had a pediatrician and then a second pediatrician that followed me through high school. And then when that was time with them was complete, I moved to an adult primary care. Okay, that's about it. Thank you.
That's a good laundry list. What about you, Megan?
Like so many other people with Moebius syndrome, I was not originally diagnosed at birth because my Moebius syndrome is extremely mild, only affecting my facial muscles, and that's just about it. So growing up, I had a team of 11 doctors from the time I was born to the time I was 1.5 years, until we finally got some information about Moebius syndrome in and of itself, and went to Toronto to the 2 specialists there, whose names I completely forget. Sorry if you're watching this. No offense, thank you for helping. When I got diagnosed, that was just basically it. I was very fortunate that I didn't need any surgeries and I didn't need any radically special treatments other than, of course, the speech therapy, making sure that I'm having my therapies done when I was a kid. And that was just basically it. I got very, very lucky. So I'm very grateful for that. But there was definitely some steps in my pediatric care that we had to continuously remind our pediatricians about my Moebius syndrome, about what it meant, and definitely keeping up to date with the current medical breakthroughs that were happening within the community also was something major that we had to keep an eye on for my pediatricians.
Oh, okay. That's interesting. Thank you for sharing that. And Michael, how about you?
So I'm probably missing some because most of the doctors that I dealt with were from a very early age, like first few years of life, as far as a pediatric surgeon and any type of surgery. Doctors that I saw for surgery, mainly a pediatric surgeon, also pediatrician, or and then ophthalmologist, a pediatric ophthalmologist. So those are the few I really remember. And
thank you. Along with that, Michael, we can stay with you. What types of surgeries, how many surgeries approximately did you have?
So I personally don't remember any of the surgeries, or have very minor memories. But I believe I had around a dozen surgeries. I had mostly, I also have a pretty rare form of Moebius syndrome, dealing just mostly with my eyes, where I have no movement in my eyes and can't blink. And so there were times where they went in to raise my eyelids, and then they would get them too high, and so they would lower them a little. And so a lot of different surgeries concerning that and where best to kind of position my eyelids. So that primarily is what happened there.
Okay, we'll come back to that. I have more questions, but Kara, let's hop over to you because you mentioned surgeries. What kind of surgeries did you have as a child?
Well, I'll try not to go on and on, but I'll do my best. So within the first year of life, I think my mom has recently told me I had about 5. So I had one side of the lip repaired, then the other side, and then some taping therapy in between. And after. Additionally, there was some initial repairs to the palate, to the hard palate too, and to the soft palate. later in to help me with speech. It's a lot of air transfer. So at 5, I had what is called a pharyngeal flap to try and bridge the gap there in the throat area, and then ear tubes, multiple sets of those. So I think that probably accounted for a couple surgeries there in the first year. And then after that, I had into my my tweens, we had one big bone graft. 2 more of those would soon happen because the bone in the teeth was very compromised. And then I had rhinoplasties and revisions of that, and some ear patching because holes were blown in the ears from so many ear infections. So that's kind of just a quick flyover of the last 40 something years, most recently having jaw surgery in 2019. So I hope that provides some context.
Yeah, definitely. I think that is, I was going to exactly say that. I think this is really good spread. We had Megan, who didn't have, any surgeries. And then we have, you who's had quite a few. So, and then Michael, I think you're right in the middle with a dozen.
Yeah, I had one other, I also, when I was born, I had strabismus. I can never say that right, but my eyes were not centered they weren't centered. And so they had to do some surgeries to bring them in to center them. So
yeah, absolutely. That is, we see that a lot in and out of the craniofacial community. So thanks for mentioning that one too. So I think here I would like to just kind of ask an overall impression, and we'll start with Megan, who maybe had some of the lesser invasive treatments. What was your sense of how your pediatric doctors, what sense did they give you? And what I mean by that, did you feel like things were in control? Did you feel like they were confused? Kind of paint a picture for us of what your interaction with doctors were as a child.
For me, as doctors as a child, I had 2 pediatricians growing up. My first one was very nice. She was very understanding, and she was very intrigued about Moebius syndrome because she had never heard of it, which unfortunately you find in this community, a lot of pediatric doctors don't. So it's kind of a weird play on the idea that the parent is educating the doctor. But she herself did a lot of research into Moebius syndrome and also kept up to date with the medical materials. However, when she retired from the practice and my brother and I got a different pediatrician, she was less so, very less so interested in Moebius syndrome. She only saw it as, okay, it's a facial muscle thing, whatever, I don't really care either way. So she was very uncaring about it. And I do remember distinctly one time they were doing student training doctors. So students were coming in to shadow the pediatricians when my brother and I were there. And she mentioned it to the student nurse who was shadowing her. And she said, yeah, this is very rare. You're never going to see this again. And she let the student nurse touch the back of my neck to feel the nerves, to do facial muscle cranial tests on me, extra stuff. And I didn't mind because, again, when you have Moebius syndrome, that is very much just bread and butter, like every other appointment that you go to. But yeah, so that was basically it. First one, great. She really wanted to know. She was really interested. She wanted to make sure that she was providing the best care. Second one, not so much. She didn't really care either way. And yeah, I got to be used as a guinea pig one time. That was fun.
Definitely. One question, follow up on that. Now, does your brother also have Moebius syndrome?
He does not. Like a lot of people with Moebius syndrome, our siblings do not have Moebius syndrome whatsoever. And I have 2 younger brothers, all from the same father, different mothers, and that they don't have Moebius syndrome. They have no facial muscle. Hang on a second, it'll come to me. Facial muscle weakness. They had absolutely nothing. And on the record, no one else in my very extended family has anything like this at all.
Okay. Excellent. Yeah. Thank you.
They've pretty much, I think, determined that it's not genetic. So I don't know if we know of a family that has multiple people with Moebius syndrome in the family. So.
Oh, thanks for adding that, Michael. Yeah, absolutely.
Yeah.
What about you, Michael? What was your experience growing up with the providers you interacted with?
So my general pediatrician, I don't really ever remember it like being a kind of a topic. Like I just saw them for normal healthcare, when you're sick and things like that. I had a pediatric ophthalmologist that I remember being very nice. And the one thing was in Las Vegas at that time, there was one pediatric ophthalmologist. And so that was kind of where I had to go. And I thought the care was good. And but there also was a point that it got to where she didn't really know what else to do. So, but at the same time being very kind and a good doctor. It's just not a lot known about the condition and what to do. So
Definitely. It's so important. And I hear, a couple of things, like it's so important when you have that kindness, it really makes that impression. Kara, what about you? What was your experience with teen care?
I pretty well had access to the team for the most part at Children's. They were still kind of developing what that looked like in the years after I was born. And so there was, kind of that initial development of trying to pull in those providers that would help. So ENT and orthodontics, and they're all kind of working together and talking together for the first time, really, in the early 80s. And then that grew into like a more clinic environment into the later 80s and early 90s. And so I kind of caught that wave a little late, but I got, I caught it. And but what was interesting, I think, a lot of talk about pediatricians, and we had a tough time with that. I think it was probably hard to get one where I was at that time in 79, 80. But where we ended up was a perfect spot. And he was a delight of a human being, and it was a great practice. But going back to like the surgical care and stuff like that, that was all at Boston Children's Hospital. And, I can't say enough about what they've done and how they've shaped and how I have come out, and also how that has then affected future patients and their care. So I'm very happy with it.
Awesome. Thank you. Thanks for sharing that. I know we talk about wanting that cohesiveness of care, and part of transition, what we're talking about, is so important. So let's go there now. How would you describe your graduation out of your pediatric care? What did that look like? And I guess, who are you still seeing in those specialties, if not the same person? So do you still have an ENT? Do you still have orthodontics, things like that? Kara, I'll let you start. And just, who are you still seeing, and how would you describe figuring out who that person is?
Yeah, so it happened quick and slow all at the same time, So I tried to maintain some of those relationships, those care providers, some of them as long as I could through like the age of 26, even into a few years ago with one particular surgeon. But unfortunately, things, just they are either you don't have access to the person, or they slowly become the wrong fit. So what you find is, the more, I ended up doing more research and reading and seeing that like other people were doing other things around, jaw issues. So that forced me to change providers. Around my mid 20s, that was a time where I was still seeing a lot of the same providers, and then slowly just kind of cycled out of seeing some of those people just because I aged out of the system. And so I couldn't go to Children's Hospital in my late 30s or even in my early 30s. So that was out of the question. And so it was then trying to figure out, well, who that I know has privileges at these other adult medical hospitals, who has the privileges to go to the OR, and which OR at what hospital in Boston. And so it became that, early mapping. And then as you kind of progress physically, sometimes those people aren't the right fit, which is what I was speaking about earlier. And so you have to then, unfortunately, sever ties with them and move to the right person or for you, and what's the right fit for you. And that, I think the most painful part of that is the emotional side of it. Knowing that you have to walk away from someone that you had a tremendous relationship with, a rapport with, a connection with. I remember leaving my dental, my orthodontics, and just being so sad, like, oh my God, I'm never going to see him again. Like, I mean, just really, just sad. And so, but then also knowing, okay, well, I am going to this other dentist that I have seen sporadically while I was at Children's, and now he's my dentist, and he's my prosthetics person for my teeth. And so that all worked out quite well, because he's my prosthodontist and my general practitioner. But I think it is just trying to figure out, well, what's going to work for me, and where does the medical pediatric side of things stop? And then once you kind of understand that it is kind of a slow motion, but also happening rather quickly, it seems, all at the same time, event, that you are, kind of slowly progressing now on into this new journey. And ultimately, hopefully you get better care as your voice is heard more. So, and I'll talk some more about that soon.
Perfect. That's a good point from healthcare transition documentation. It says it is this slow but fast. You need to start preparing. Guidelines say around 14 years old. And then you prepare, it's slow, you're getting ready. And then of course you turn whatever age it is, and then it's the hard cutoff. So I like that characterization of it. What about for you, Megan? When you were transitioning into your adult providers, who did you have to transition? And what was that experience like for you?
For me, for transitioning, oh, good grief. If I think back to it, back when I was a kid, again, I had one pediatrician, but unfortunately things were happening in my life personally, so I wasn't going to the doctor very often. And very fortunately, I didn't have a lot of doctors. I didn't have orthodontists or surgeons or orthopediatrics that I had to go see routinely because of my Moebius syndrome. Essentially, aside from the facial muscle paralysis and keeping up with the latest text, there wasn't really that much difference between my medical care and my brother's medical care that needed extra intervention. But when I turned 18, as all 18-year-olds do, we can no longer go to my pediatrician anymore. But during that time, I started doing college. So getting healthcare really did fall by the wayside. It wasn't until I was 20 and I was looking to study abroad in Barcelona that I decided I should really go and actually get an adult doctor and actually start taking care of myself a little bit better. And it was very well overdue anyways. So in my office, in my doctor's office, you have rotating doctors. So there's never one doctor that you can just exclusively see, and that's going to exclusively see you, which is great if you really need a very soon appointment and your normal person is available. But when you have Moebius syndrome or another a very difficult medical problem that you need like some help with, it can be very difficult to re-explain every single time what you have, why you have it, what it affects, and the potential. Like Moebius syndrome, it's very heterogeneous, as the last conference did state. So trying to keep yourself up to date and trying to explain that to a medical professional of what could happen is very taxing almost. So for me, it was very annoying to have to continue re-explaining every single time. If I see this person again, are they going to remember? Are they going to put it down in their chart? If I go see another doctor, are they talking about it? Will they know? Will they even care? So absolutely, the transition was very different. It went from, very interested to, okay, I understand, and this is a no, but I'm not going to really be concerned with it unless it becomes a problem, to I don't even know if they even recognize it or if they think that I'm just completely making it up. So yeah, I definitely say that advice. If you don't feel like a doctor's office is really kind of cementing you in there and you feel like you are really getting sick and tired of having to re-explain, then find yourself a doctor that's actually going to take the time to ask questions, understand where you're, what it is you have, and actually try and take an interest into all the medical research that you're doing, and even offer to like help with that as well. So that's what they, in my opinion, should be doing anyways, if you're presenting with this. Because if they're not ready for it, it can cause real problems for you later on down the line.
Great advice. Excellent advice. And not, ignoring that emotional labor that it takes to explain that. It's very important for your provider to have that relationship. I agree with you. Michael, what about you? What has your experience been?
So mine's a little different also in that. So the one pediatric ophthalmologist I believe she had left town, and I was at a point too where they didn't really know what to do. So wasn't seeing the doctor that often. Only when I needed to, or if there was an issue that came up. And so then we found another pediatric ophthalmologist. There was actually a group, several more had come to town by that time. And so I started seeing this pediatric ophthalmologist, and then kind of have stayed with her even as an adult. She doesn't see a lot of adults, mainly kids, but I was able to stay with her. But it gets to that point too where she's not really sure what to do. So it's sporadic, and when I need something, or if there's an issue that comes up. So the transition, it was easy because I pretty much stayed with the same doctor, but kind of hit some walls as far as knowing what to do, and different things like that.
Right. If you are looking for a new provider, do you have any advice on how to look for a new provider if you might find yourself in that situation now? Do you have a game plan?
I mean, at this point, and this would be difficult and difficult for a lot of people, but I would rather go see someone that really kind of specialized in or had a lot of more experience with Moebius syndrome, and that might entail going to California or to some research hospital or university, where they were dealing with it more, because I've had so many experiences of having a doctor not know what to do next. Or so, for example, the conference that we had in this summer, I met some doctors that are more on the research side, but they see a lot more people with Moebius syndrome and have a lot more knowledge of what might be out there. So there's a couple of things that they brought up that I hadn't heard of before. So again, it might be difficult to actually have to travel to see somebody, but I guess the tip is to find someone that either has a lot of experience with it or is connected to where they could talk to people with that have a lot of experience.
Fantastic points there. I think you bring up so much. Going to conferences like the CCA retreat and the Moebius Syndrome Foundation conference that you guys have, I think it's vitally important, because you do get in that network. If you're looking for a different provider, if you're not in a fit, or you've hit a wall, your story, Michael, resonates a lot with mine. That was my experience growing up, was hitting wall after wall. And you often just delay care because nobody has a next step that they're willing to hand you. So I think that's great to network, to go to conferences. And I guess my last point there would be to seek out team care if it's appropriate. I know Moebius syndrome is a little bit different. I've actually talked to several people recently looking for doctors who have a real depth of knowledge there, but some of the other syndromes, there are centers around the country with lots and lots of knowledge. So trying to lean on them for next steps is often a valid option there. So good points there. And I do want to highlight that a lot of times these larger centers will also assist with transition planning. So don't sleep on that. If they offer that, be sure that you're taking them up on that. Let's move into another question. This is more of kind of story time. Tell me a time when you really felt like you were at the age, and tell me that age, that you got to make a healthcare decision on your own and you were making it, not your parents. Megan, would you like to take that one first?
Sure. Good grief. I think that was definitely when I was 20 and I saw the doctor for the first time in a long time. Again, that was just right before I was going to Spain. So there were some vaccinations I needed. There were some, health guidelines I had to look at together to make sure that I was in guide with all that. And that was a time where I was asked, like, do you want this vaccine? Because I hate needles. It's ironic because I love to sew, but I hate injections so much. It just freaked me out. And that was a good time when she asked me, do you want to get this certain vaccine? You don't really need it, and you can always put it off till like the next time I see you next year. But is this something that you want? And I got to say no. And I felt empowered by that. Like, oh my God, I just said no. Like she said, I don't need it. I'm healthy. It's not going to affect my health either way. Just a precaution, just in case if this random kind of thing happened. That was rare. So yeah, it felt really good to be able to say no and actually be able to be heard by that, which was really nice, and not have to kind of rely on my mom and like give her pleading eyes, like, please don't make me go through this today. Okay, I have plans. They're not adult plans, but they're plans. So yeah, I was 20 years old. I would assume it would have been sooner by the time I was like 18 if I really did go to the doctor religiously. But yeah, that was the time, and it felt great. And ever since then, when I felt that power, I realized now that I'm in like control of myself. So now I have to do my own research, listen to my body, and make sure that the choices I make are the ones that I want to be made for myself. And consequently, if I don't, then I'm going to suffer the consequences for that. So yeah.
Awesome. Thank you. What about you, Kara? What is a pivotal moment in your life?
I think really everything for me was rather recent. In 2016 or late 2016, early 2017, I started having a lot of hearing loss, jaw pain, and a lot of TMJ issues that probably stemmed from the bone graft that I had when I was 12. And the recovery from that, I had a splint put in that was wired into my around the TMJ, both TMJ joints for 2 or 3 months. And so I think it did some damage. I also probably have done some damage with poor biting and the like, but bad mechanics around chewing and speaking and other things. So I had a lot of arthritis in the jaw after many MRIs. I had been seeing this one doctor since I was a teen. And so that oral surgeon, I just felt like there was only this, the big jaw replacement really was the only way. And I thought there's got to be a better way than that. And so I talked to a lot of my other pediatric doctors that I still had had contact with through a nonprofit up here in Boston, and they were all saying this one name. And then I talked to, another person that wasn't even involved with those folks, and he was saying that name. So I was like, all right, well, I'm going to go check this out. So, I grabbed my mother and we went up to see him, and he was a guy. And he did a very, very low invasive surgery on me in 2019. It was very empowering to do this research on my own, to read about him, to watch a lecture that he gave. He was an engineer, he's a doctor, he creates his own tools, he creates his own, so I was like, I did a ton of research, read everything about him, watched all the YouTube videos that were there, things on Vimeo even, everything that I could learn about him, and then go see him and talk to him and hear what his solutions were. And his solutions were a lot less, a lot less invasive. And so he did arthroscopic surgery on the joints to remove the arthritic tissue. And then I'm following up, and most recently had some injections of cortisone for pain as that comes up and happens. So, and then he's monitoring me, and then we'll go to additional care and treatment as needed. But that was a very empowering experience, to be able to choose a person, tell my mom about it, have her trust me on it, and really make sure that I had the evidence and the conversations from the research I did and the conversations I had with people that I know my mom trusted, so that my family would be okay with it. Because again, it's always a family decision for us. It's not just a me decision, it's an us decision. And so it was really important that I had their buy-in and I had their blessing. And he was the right guy, and I'm glad I made it all happen. So thank you.
Yeah, absolutely. Thank you. What about you, Michael? What's a moment in your life?
So I haven't had to really make a major medical decision as far as my eyes by myself. The real decisions that come to mind is, for example, when I was went away to school, or specifically I went when I was 19 on a mission for my church, and to a different place, to California. I actually went to California, pretty close. But so I had to decide, do I find a doctor? Do I see the doctor? How often do I see the doctor? Like, I wasn't, not that I was forced before, but it wasn't just a routine thing, or I had to actually do something. And then continuing on after that, even though the same doctor, same kind of questions: when do I see her? How often do I see her? So not major decisions, but as far as surgeries or type of treatments, some of those might be coming up, but just smaller decisions of, I'm in control now of when I see, how often, and who. So that's what I would say.
Yeah, no, that's great. Thank you. We'll stick with you, Michael, and tell me, were your parents, were they the primary people helping you make decisions as a child, and do you still consult them?
Yes, they were. I mean, my mom pretty much, she knows more about my medical history than I do. So to this point, I don't remember those, a lot of those surgeries, but she does very vividly. So, and yeah, I still consult her. Like, she went with me to the conference and met these, the new doctors that I've met recently. And so she's still very involved in all that kind of healthcare and who to see. So I don't know if that answer the question.
Yeah. Absolutely. That definitely answers it. And I will say, so many of us have that same experience where our parents have our entire medical history. And one of the tips from gottransition.org is very important. That is a thing that you need to plan for. So parents, now, if you're doing this for your child, keeping that documentation in a physical way, it can be a file on the computer that you just add to. It can be a physical file where you print things and put papers in. I probably don't recommend that as much anymore, but some type of organizational system, and the handing of that off to your child is best practice. That will be something that you can build together starting at that age 14. Show your child after you go to the doctor, maybe you jot it down in this notebook. maybe record it on that spreadsheet, show them what you do and start preparing them so it can be physically handed off. Michael and Kara and I are in a bit of a different generation where I know the handing off of my medical records to me was a very mashup of things. There were giant old files that probably could not be accessed anymore. As far as like, CDs that had no labeling on them, that's not my not my mom's fault, just she kept everything, but it was all different types of documents and files. So start fresh, new parents, keep it up to date, and be ready to hand that off is the best practice. Yeah, thanks for sharing that. And Kara, I know that you said that you still consult with your mom. It's a family decision. What about you, Megan? How does that go with you? Were your parents the ones, and do you still consult with them?
My parents were definitely the ones handling all my medical needs right there, along with my brother. Again, aside from Moebius syndrome, it was very even Stevens. We got our vaccinations. We saw our appointments very regularly on time. If we were sick, we were pulled out of school, which sometimes sucked. But as I started getting older and I started recognizing more things in my body, they started listening to me more. So when I said, I don't really feel good, they'd hit me with some cold medicine. They'd take me to the doctor if I needed to. They let me stay home. And even now, as an adult, I'm still consulting them. Especially with problems in my body. Like recently, last year, I had severe chest pains, like right in my heart area. And I had no idea what it was. I asked my father about it. He said, why don't you just take a break? You've been lifting heavy things. You probably just overworked the muscles. And when the pain didn't go away the next morning, he said, get yourself to the doctor, go get checked out by urgent care. And they did EKG and they found nothing, no evidence of a heart attack. And it was within a 24-hour period. So they would have seen something. And they said, yep, you just overworked those muscles. Take it easy, take it relaxed. And even now I'm still consulting them, like, hey, I've got this, hey, I got that. Have you experienced this? What has been your take on it? So I'm absolutely looking to all the adults in my family, all my parents, and I'm asking them, is this it? Is that it? And getting their advice. Because one, it's cheaper, and two, they're going to be a little bit more honest with me about treatments. So yeah, I definitely do consult them from now, but they do understand that boundary that this is my body. I'm going to make that decision. And they totally respect it. And they actually like it when I ask them for advice. So yeah.
Absolutely. I think parents out there who are watching this, that's one of the greatest things. If you empower your child, they're never going to go away. They're going to keep coming back and asking your opinion and for your help. So thank you for sharing that. Another best practice listed on the gottransition.org is to write transition planning, healthcare transition planning into your child's IEP if they have one at school. I'm not sure if anyone on this call had an IEP, and if so, was transition planning at all addressed in your IEP?
I'm just going to say that I had an IEP in elementary school, but unfortunately I did not moving forward into junior high. All of that was then all of that stuff went to the back to the medical providers because it was a regional. So yeah.
I had an IEP all through school, but I don't believe transition planning was ever a part of it. Not something that I really thought about or knew to put in there or to talk about.
Definitely. I think that if it's not automatically in your child's, you might have to request it. So they might not have known, they might not have been doing it back then, but it's something that parents now should definitely be aware of, that you can put that in there. Let's see, what else do we have? We are doing really well. We've got just a few more minutes left. I think I have two more questions and we can just again round robin these. Is there anything, you can go either way with this, that you wish that adult doctors did that your pediatric doctors did, or vice versa? Megan, what about you? Do you have any wishes for how the doctors acted?
Yes, there's absolutely a lot of things I had to say about adult doctors. I find that pediatric doctors are a lot more open to parents talking about the disabilities of children, because they understand that there's a lot of different literature and a lot of different complications with kids. So I feel like they're a lot more open with the idea that the parents know what they're doing, they know what they're talking about. But then once you get to an adult and you look like this, they start to judge you on that. They start to think, oh, autism, Down syndrome, something with the brain. Maybe she doesn't understand exactly what she's saying. So I find that they're actually a little bit more judgmental about that. They're a little bit more condescending, and they're not going to listen to you as much. So that's my biggest thing. You know, absolutely, they may not listen to you, and it can be kind of frustrating with that, because in the back of your mind, like, how much of that did they actually understand, respect, and are actually going to like acknowledge going forward. So if you have any doubts like that, then absolutely move on. You don't have to see the first doctor, you know, forever. My own health teacher back in high school said that she tried 5 different doctors for various reasons until she found one that she was comfortable with. So I say take that advice too. It's your medical care. This is your body that we all know we have to very well respect and treat and take care of. So if your doctor is not in line with that for whatever reason, whether it's something they said, something they're doing, or even if it's just a gut feeling, definitely move on and find someone that is going to listen to you, respect you, and actually make a interest in Moebius syndrome, because it is a part of our lives. It's going to be a resounding factor. It's never going away. So make sure they understand that and they respect that.
Awesome. Thank you. What about you, Michael?
I mean, it's interesting since my pediatric, as far as the ophthalmologist, still been the same. So she kind of has continued to operate the same. But one thought I had is it seems like I hear about adult doctors or doctors for adults not having as good of bedside manner so many times as with children. I think we kind of we're trained, or we just have an innate feeling of children, and to take care of them and to protect them, no matter if it's your own children or your siblings' children or just children in general. And so I think doctors kind of are the same way, where they can be nicer or more not interested, but just more want to treat the children better and have it front of mind than adult doctors. So I agree with Megan, like, you don't have to stick with the same one. There are doctors that are great and have great bedside manner, and you can find a good fit for you.
Absolutely. Thank you. Kara, what about you?
I think I just want to comment on like specialization. Doctors that we see as pediatric patients are really specializing in a very niche area, craniofacial conditions. They're focused on, they're not only ENTs, more broadly, but they are very focused. They're treating, people with clefts, with ear, nose, and throat issues, or people with Pfeiffer syndrome, or people with 𝐴𝐴 syndrome, etc. They have that very specific training, and we're provided that right off the bat, like as soon as we're born. And so we then, our expectations as families and our expectations as patients is that like everyone's going to have that level of specialization. Well, unfortunately, that's not true, and that comes to bear when you become an adult. I feel like you go to an ENT now, even if someone says, oh, they know about clefts, or they know about, they know how to treat, with me, I have a, eustachian tube dysfunction. He'll know about that, or she'll know about this. Well, not always. And so, and then it's impossible. Sometimes it's impossible to get in to see that person. So access is an issue, and the adult treaters are more broadly trained. They're not, because they're seeing all sorts of people. So we're very blessed at the beginning of our lives into our, young adulthood. And then when adult care comes, that specialization goes away, and you really have to hunt and find someone with the criteria that you want, the training that you desire, and that is a good fit. And so, as Megan and Michael have both said, that's hard to find. And sometimes you'll have to pass on bedside manner and just go to the person with the best set of hands, because, and the best mind for it, because, otherwise you may not, get the treatment that you truly want for your physical body. So just something to think about.
Yeah, that's an excellent point. And to the point that they may not be have the same bedside manner. That's why it's even more important to prepare your child to advocate for themselves. If you are indeed, having less opportunity to choose someone and you need that person's specialty and expertise, then you're going to have to be a stronger advocate for yourself, and you're going to have to be resilient, and you come prepared. I think that's another great thing you can teach your child, is to come prepared to their doctor's appointments, have their questions written down, have the things that they need, allergies, medication list, have those on hand, so that if this person isn't maybe wearing kid gloves, as they say, that you as the patient are in the best position that you can to make the appointment efficient and helpful to you. So excellent point there. I guess my last question is always, what advice would you offer someone thinking about healthcare transition, just in general? How would you advise them to really make the most out of their transition? And Michael, we'll start with you.
I would say the number one piece of advice I would give is to, as early as you can, take ownership of, take ownership of what you do. Like for me, for example, when I was young, my mom would put drops in my eyes and put nighttime ointment in my eyes. But as I grew up, and for sure now, I don't have my mom putting drops in my eyes or ointment in my eyes. So I have to take ownership of that. I'm not as good as I should be. And that's one thing that why I think this is good advice, is take ownership to where you are, you're responsible, and that what you do can affect your life going forward. So whether it's with me, eye drops, or whether other conditions, certain exercises or things you have to do, or things that the doctors want you to do that'll make life better for you, practice that now to take ownership of it. So then when you don't have your parents reminding you or doing it for you, you're still doing it.
That's very good advice. That's excellent. Thank you. What about you, Megan? What advice would you offer?
Definitely the advice I would offer is that we have all grown up with the idea of Moebius syndrome in the back of our minds. It's not a constant thing that we all think about, because we all have things we like to enjoy in our lives. We have other people in our lives, and it's not something that is constantly on them. At the same time, we have to remember that that's the same for doctors and leading medical professionals, whether they are surgeons, pediatricians, orthopedists, physical therapists, et cetera, et cetera. So my one advice to you is that as you are making that transition, remember that as much as it is on your primary physician to remember about your medical needs, it is also on you to make sure that you are helping them understand it, and that you are also doing your own research. This is not only just beneficial to your primary physician, because they may have other patients and they may have other people that they are looking for. It's also great for you, because when you are educating yourself about what is going on in your body with what the research of the Moebius Syndrome Foundation, you're also making sure that you are educating those around you, including other friends in the community who may not be able to get in touch as much as you are, and also with the people around you, so that they may also be aware in case something goes wrong. So take the time to educate your physician and make sure that you are clear with whatever that is that you need to say and relate to them. And hold yourself to that same standard with them as you do with yourself. So if they are not understanding, if they don't really seem to care, and if they are not really expressing that view, then definitely cut them off. It can be very tenuous if you are trying to do this all the time, or if you've had to do this a few times and just having to re-explain it can be very exhausting. But in the end, it is very much worth it once you find that one physician that actually gets it and wants to be able to grow with you and learn with you and be able to respect this.
Thank you very much for that. I agree. Kara, what about you?
I think I would recommend that folks start thinking about these transitions at 12, 13, 14 as the nonprofit says. I think also talking with your current pediatric providers about people who they see as residents or fellows or people they're training, because they'll be the future of the field, and whether or not they would be good caretakers later on and providers later on, or if they know anyone in the adult sphere that they have good relationships with and that they know would be able to treat someone with a craniofacial condition, an ENT, a dentist, etc., something along those lines. Making sure that you ask and you keep asking those questions, and try and keep it top of mind for appointments and annual appointments especially. And the other side of it is too, I think I worry and advocate a lot about mental health, and psychosocial mental health and well-being. I think making sure that you talk to maybe the special ed person at the school, or the person you may be seeing in clinic, if there's a psychologist assigned to the team, and making sure that there is some adult options for vocation, for mental health, and for those kind of life things that happen, because school ends too at 18. And so I want people to realize that there are options, and there are services and things that people can do when they, even if they're not going to college or getting a job, there's support out there on the vocational and mental health front for those supports. It's really important, I feel. And also checking in with the Centers for Independent Living in your area or your region of the United States or beyond, because those centers may also have some good information, and you'll be able to build relationships with them and talk about a variety of different ways in which you can kind of transition into adulthood in that way. They'll have places to live, PCA care, etc., things that you'll need if you are a part of this craniofacial community. Thanks.
Absolutely. Thank you all so much for being on this. I definitely want to thank our parents. All of us had wonderful parents, it sounds like, who helped us navigate these journeys. So a big shout out to our parents specifically, and the parents that are watching this. You're obviously putting in the work to educate yourself and prepare your child. So extra kudos and gratitude to you. Definitely want to thank our providers. Also sounds like we all had wonderful pediatric providers and people that have really invested in us. So thank you to our healthcare community that put that extra bedside manner, that put that passion and love and kindness into what you do. It makes a huge difference. We're sitting around here talking about it. I also want to thank the Moebius Syndrome Foundation and remind you all out there that Children's Craniofacial Association, we can help you if you need those second opinions. A recurrent theme we heard is find the doctor that fits with you. We do offer financial support to travel to see other doctors if you need that care. So please reach out to us, and please reach out to the Moebius Syndrome Foundation if you want to find specific doctors, a community, the latest research. We only exist to help our craniofacial community, friends and family. So please plug yourself in. And I think that is my closing thought for this wonderful webinar, is that don't wait too late to plug in. Kara, you hit on it right at the end there. It's not just about the physical needs, it's also the mental and the social aspect of it. So as a young parent, as a young person, plug into your networks now, so that when you, Kara and I often joke, hit that 26-year-old cliff, when school's over, college is over, work is, maybe not picked up to where you want it yet, you have a community to support you and help you weather the storms and find the next big thing in your life. So again, thank you all for watching, for being a part of our virtual programming. Thank you, Megan. Michael, and Kara. And I hope you all found this helpful, and we look forward to seeing your comments and feedback. Thank you.